Hello everyone, my name is Maisie Arroyo. I will be doing a presentation on healthy and safe sex education. Hopefully we can learn something new today. So in this presentation, I will be discussing topics on STDs, STIs, unplanned pregnancies, developing healthy relationships, and intimate partner violence. First topic of discussion is sexually transmitted diseases, also known as sexually transmitted infections. So what is it? It is any disease or infection that you can get while having some type of sexual contact. What causes STDs or STIs? STDs are caused by bacterial, viral, and parasitical infections. How are STDs transmitted? So modes of transmission are from person to person through blood, semen, and vaginal or other bodily fluid contact. Symptoms. Symptoms caused by STDs vary. Some people don't show signs of infection and sometimes seem perfectly healthy. It may take days after exposure before symptoms start to appear. And some of these symptoms can be sores or bumps around the genitalia, oral or rectal area, painful burning urination, unusual discolored malodorous penile and vaginal discharge, unusual vaginal bleeding, pain during sexual intercourse, lower abdominal pain, sore swollen lymph nodes, fever, and rashes. So these are some pictures of some of the symptoms that somebody with an STD would probably have. STDs. These are the most common STDs. Chlamydia can permanently damage a woman's reproductive system, causing infertility. It is also known to cause ectopic pregnancies. Gonorrhea is most common in people between the ages of 15 to 24. It can infect the genitals, rectum, and throat. Hepatitis is a liver infection caused by a virus. The most common viral hepatitis are A, B, and C. Genital herpes is caused by two types of viruses, HSV1, HSV2. HSV1 is known to cause oral herpes. They appear as cold sores or fever blisters on or around the mouth and can be spread to the genitals with contact. HIV is a virus that attacks the immune system. It can lead to AIDS if not controlled. There is no cure for HIV, but it can be managed through proper medical care. Syphilis can lead to serious health conditions if left untreated. Syphilis is divided into primary, secondary, latent, and tertiary stages. HPV is a virus that can cause genital warts and cancers. In 2018, there were 43 million HPV infections. Trichomoniasis, also known as trich, is caused by a protozoan parasite called Trichomonas vaginalis. It most commonly affects women than men. Most people don't show any signs of infection. There were about 2 million infected in the United States in 2018, but only 30% of those showed symptoms. How can you protect yourself from STDs? You can prevent them by abstaining from sex. This is the most reliable method for preventing STDs. Prevention by vaccination is safe, effective, and recommended in preventing Hep B and HPV. Reducing the number of sex partners definitely reduces the risk of STDs. Being in a long-term mutual monogamous relationship decreases risk for STDs as long as both partners are not infected and they mutually agree to be sexually active with just that one partner. They need to be open with each other and have honest conversations. Latex condoms are highly effective in preventing infections if used every time during vaginal, oral, or anal sex. They must be used correctly. Non-latex condoms can be used, but have a higher breakage rate. Natural condoms are not recommended in preventing infections. Unplanned pregnancies. Unplanned pregnancies are either unwanted, not desired, mistimed, or sooner than expected. I'll discuss the effects it has on health, social, and economic outcomes. In health, unplanned pregnancies can affect the mother and the child's health. Some mothers don't usually find out they are pregnant till they are already done with the first trimester, so they are less likely to receive prenatal care. Unplanned pregnancies can cause mothers to become at higher risk for postpartum depression and mental health problems. It also causes higher risk rates of preterm birth, low birth rate, and infant mortality. Children that are a result of unplanned pregnancies are less likely to succeed academically and develop socially and emotionally. Social. Effects on unintended pregnancies socially can delay personal goals, stress on relationships with family, friends, significant others, and worship or spiritual health. Economic. Economically, unintended pregnancies can disrupt educational goals, which can then severely affect future income potential and the family's financial well-being. Unplanned pregnancy cost state and federal $21 billion in 2010, helping to cover medical care costs. Prevention of unplanned pregnancies. So we have family planning and contraception. Family planning provides education, counseling, and medical services. It involves talking to a provider about reproductive and sexual health, planning pregnancies, and the use of contraception. In family planning, you can discuss your birthing space, the family size you desire. If you are not ready to become pregnant, you can discuss different options of contraception available and choose what is the best for you and your personal needs and goals in family planning. Family planning provides resources that can help prevent unplanned pregnancies. As far as contraception, there are many contraceptions or birth control methods available. The different type of birth control available are reversible or permanent. The different methods of birth control are IUD, hormonal, barrier, fertility awareness, lactation amenorrhea, emergency contraception, and permanent. So choosing the best contraception method depends on your lifestyle and needs and family goals at the moment. Contraception methods. The intrauterine device, or IUD, is a T-shaped device that is inserted into the uterus. There's a hormonal and a non-hormonal copper device. The hormonal device can last up to 3 to up to 6 years, and the non-hormonal device can last up to 10 years. This form of birth control is low maintenance. There are several hormonal methods available. They are implant devices, injection, oral contraceptives, patch, and vaginal ring. Implant devices are inserted under the skin of a woman's arm and can last 3 years. Injection shots are given every 3 months. Oral contraceptives are pills that need to be taken at the same time every day. They are not recommended in women over 35 years old and a smoker, or women with a history of blood clots or breast cancer. The patch is applied on the skin of the lower abdomen, buttocks, or upper body. It is exchanged weekly or every 3 weeks. The vaginal ring is inserted into the vagina and is removed every 3 weeks and is replaced with one after the 1 week is through. And here's a picture of the different contraceptive methods. So barrier methods. Different barrier methods are available. They are the diaphragm or cervical pap, sponge, male condom, female condoms, and spermicide. This method prevents and blocks sperm from getting into the cervix or vagina. Fertility awareness method is being aware of your fertile days. You track your period and fertile days and don't have sex or use barrier methods to prevent pregnancies. Lactational amenorrhea method is conditional and temporary. The 3 conditions are no menses after delivering a baby, fully or nearly fully breastfeeding, and less than 6 months of delivering a baby. If these conditions are not met, a barrier method is needed. Emergency contraception is not a form of regular birth control. It is used if birth control methods fail, such as a condom breaking, or if not currently on birth control after unprotected sex. There are 2 forms of emergency contraception. A copper IUD can be placed up to 5 days after unprotected sex, or you can take an emergency contraceptive pill. There are 2 methods of permanent contraception. One is for the female and one is for the male. Female sterilization or tubal ligation is a procedure that closes or ties a woman's fallopian tubes. Male sterilization or vasectomy is a procedure that cuts and closes the vas deferens, preventing sperm from ejaculating. Intimate partner violence is physical and sexual violence, stalking, or psychological harm caused by an intimate partner. It is a serious public health problem, and it is preventable. About 1 in 5 women and 1 in 7 men reports experiencing severe physical violence. When young adolescents experience intimate partner violence, it is called teen dating violence. Millions of teens experience teen dating violence. Victims are more likely to experience anxiety and depression, use of tobacco and drugs and alcohol, lie, steal, bully and hit, and think about suicide. Developing healthy relationships. Dating Matter Models is a 7-component evidence-based model that was developed by the CDC to prevent teen dating violence. It provides prevention strategies for individuals, peers, families, schools, and neighborhoods. They focus on teaching 11 to 14-year-olds healthy relationship skills, before they start dating to reduce behaviors that may put them at risk for teen dating violence. Youth programs are social emotional learning programs that promote expectations for a mutually respectful, caring, and nonviolent relationship. This program educates youth to help them develop social emotional skills like empathy, respect, and healthy communication and conflict resolution. Promoting and teaching healthy relationship skills can prevent and reduce the risk of getting involved with unhealthy and unsafe relationships. I hope you were able to learn and take away new information about healthy and safe sex. Please go to the link to take a quick survey about the presentation, and thank you for your time.